Growing up, Dad was in law enforcement, and that's all we knew. The patrol car, the badge, the utility belt, protecting and serving just as was a way of life for our family. And so Dad law enforcement wasn't a job he did, it was a life that he lived. One of the things he said that made law enforcement easy for him, he said, son, always treat people like you want to be treated. Do for others as you want them to do for you, and make others feel like you want people to make you feel. Several years ago, we found out that his kidneys were in renal failure, and as they began to shut down, there began conversations of when do we go to dialysis? Is dialysis an option? Is kidney transplant an option? And so it began to take a toll and have an effect because we had to look at things like change of diet. As time lapsed, we learned some things, and we referred to Dr. Rampal, and she has been a godsend of education and walking us through this process and fighting for Dad to be the healthiest that he can be.
Mr. Gordon has a very engaged and loving family. His family has been by his bedside every day throughout his hospitalization. Mr. Gordon had an opportunity to join our outpatient TIF regional dialysis clinic, and our team had the opportunity to meet him. And after that engagement and relationship, we became a family with Mr. Gordon and his family. As a result of Mr. Gordon's medical conditions, he required a few different hospitalizations. During his last hospitalization, he had the opportunity to meet one of our newer physicians here, Dr. Azizi. During that hospitalization, we were able to work collaboratively, including our hospital medicine staff, our nursing staff, our dialysis staff, as well as myself, in evaluating, managing, treating, and improving Mr. Gordon's care.
I met Mr. Gordon and his family when I came on service on my first day of my work week, and come into the room, see a patient sleeping, look sick, and I see a concerned son at the bedside. And I introduced myself. I'm like, hi, I'm Dr. Azizi. I'm your hospitalist doctor.
Early one Monday morning, Dr. Azizi come in, and after a conversation that he and I had, and me just expressing my concern that no one was able at this point to pinpoint it or what was going on, Dr. Azizi reassured me that he would do everything he could do to help.
I asked, how are things going? What's your name? And then we started our conversation and introduction, and started to discuss Mr. Gordon's condition and the concerns from his son.
After 15 nights in the hospital and some of the greatest care we've ever seen, we are finding a new normal. We're having to figure out where his strengths are and how to overcome certain obstacles. But one thing you can't do is you can't kill his spirit. He is still my dad. He still make you laugh. He'll still make you feel safe. He's still the smartest and wisest man that I know. While we were in the hospital, you couldn't ask for anything better, from the nurses coming in on a regular basis to do anything Dad needed done. Dr. Azizi, from the time that he walked in the room the first day, you could tell that Dad just wasn't a number. He wasn't just a name on a chart, that he cared about him, he cared about his health. And Dr. Rampal, she has this way of, when she talks to not just the patient, but the family, that she becomes part of your family, that she sits and she cares, and you can see the concern in her eyes.
We here at TIF Regional Health System strongly believe in working with our patient's family to create a co-management team approach to the way that we care for our patients.
It's very hard to get used to seeing someone's parent or seeing someone sick and suffering in front of you. And especially with Mr. Gordon, his son showed so much care and compassion for his father. It reminded me of my own father and how lately I have missed him, and I think about him. It brought it to a very personal level with me.